Well, let me change topics for a minute because I really like to jump to something related to 2020. I mean, this has been a year of unprecedented challenges across the globe on so many scales and irreconcilable loss for lots and lots of people. So tell me, a system that by all measures we think was in crisis well before the pandemic, what do you think the impact of this pandemic has had on the mental health care, not just in the US, but on a global scale?
Well, like many people, I think we're clearly understanding that this has had significant effect on all of us around the world at all ages. And by all ages, I mean well below 6, younger children, regression in their behaviors, all kinds of activity that we've never seen before in this volume, in this consistency. So the pandemic has created not only problems in anxiety and depression, but it has certainly triggered worsening of most mental health conditions. There's data out there now that says COVID-19 itself may cause some behavioral health problems as a result of the infection. One of the things that we're seeing, particularly in the athletic spaces, emotionally, is that kiddos who get COVID in athletic spaces, we're now looking at things called brain fog as a result of this. They're emotionally spent, they're depressed, they're anxious, their cognitive skills, their ability to think is impaired. So COVID is a strange actor. So it's not just because we're locked up, because the world has changed, because we can't go play. All that's all extremely important. But there's also the part that we need to look at that says this virus may be affecting the brain in a lot of neurophysiologic ways that we're not clear about yet. But clearly, when you look at today, the number of people in my world, in my practice world, the amount of anxiety and stress in collegiate folks is unprecedented. I mean, I've never seen it this way in terms of the depth of despair, if you will. So you start talking about things other than depression, you start talking about things like despair. You see enormous spikes in populations with suicide. So there's a significant effect that COVID has had from all aspects, whether that's the portion that we would expect. If you tell me I can't go out, I can't go see my grandparents, I can't do this, I can't do that, and thinking for an instant, I think about my grandchildren trying to keep a 9-year-old in front of a screen for 8 hours a day. Good luck with that. We turn parents into educators. Good luck with that. I mean, it's all sort of compounded itself at this point.
Kind of related to that, what we read about a lot and hear a lot about in the news today is the impact all of this has had, a pandemic, not just on the normal average middle person like myself that may end up as a patient, but as a first responders and physicians, people dealing with this daily. And as someone who still practices and still works directly, both at the collegiate level and in substance use clinics, can you tell a little bit about the impact that you've seen on first responders, on our providers, the people that are really trying to help us deal with this?
Well, that's a great question, because a couple of things about that, Jim. In the substance abuse world, a staggering increase in substance abuse problems, staggering increase in number of opioid deaths over the past 12 months. So we're seeing an increasing pressure on systems, and when I say systems in healthcare are people. Mm-hmm. Whether those are ER docs, nurses, medical assistants, people in nursing homes, people in the substance abuse clinic because they can't get enough people into the units. The system hasn't been designed and isn't brisk and reflexive enough to be able to say, okay, your facility's been approved for 10 people. but the system, the community needs 40. But we don't have the responsibility, the response built in to allow sort of increased numbers in the need. So the pandemic creates need, but systems can't respond fast enough to support that need. And fundamentally, what that does is it takes a toll. People in the healthcare space, no matter how hard they try, do become somewhat connected to the people that they care for. And if you listen to the words of physicians, you listen to the needs of nurses, it's tremendous struggle, tremendous guilt to some extent to be, oh, because I can't help them. Creative ways to let somebody die and even talk to their family. It takes a toll. And the other toll that's happening is tremendous numbers of primary care practices are closing their doors. They can't stay open. People aren't coming in. They're not getting the care that they need for other diseases. Their staffs are decimated by infection, simply because the vaccines really that we're seeing now may help that. But to some extent, we've lost practitioners. Many people my age, and even younger in their 60s, have simply retired. I'm not going to practice anymore. This pandemic is too much. It's too risky. I can't do this anymore. So we've seen a real diminution in the number of primary care practices, the number of people to support sort of the infrastructure of our healthcare system. And so it's beyond just the emotional devastation. It's the devastation of the system that we're seeing at all levels, not just primary care, but just across the board. So we have to look at COVID in 2020 as a real turning point for us. Behavioral health is going to continue to be a problem. We're going to continue to see skyrocketing suicide, substance use disorders. This is not going to stop the minute the vaccine comes. Okay, the vaccine is not going to cure the mental health system that we have seen challenged by this pandemic.